Hello, my name is Rob Dawson, and I'm here to talk to you about the zone insertion method. The zone insertion method is a clinical microsystem. It allows you to obtain optimal success with upper arm ultrasound-guided venous access. It also allows a clinician to be consistent with their practice, and within a vascular access team to establish consistency with venous access in the upper arm, so that we have a defined measurement from the medial epicondyle to guide your practice. If you're having complications, you can see where the lines are inserted and correlate that with your clinical outcomes. So not only does it give you successful insertion and optimal vein location, it also gives you a quality measurement tool for your continued vascular access practice. At the patient's bedside, the first thing you want to do is choose the arm or the side that you want to start with. I always prefer to start the assessment on the right side. What I have the patient do is move over to the opposite side of the bed so the arm can rest, and then I abduct it 90 degrees. The zone insertion method defines the upper arm zone as starting from the medial epicondyle and going to the axilla. So the upper arm zone, or total zone measurement, extends from the medial epicondyle to the axilla. From there, we divide this into 3 distinct zones. So the first thing we do is get a total measurement of the upper arm zone. And for this patient, it's 25 centimeters. So then we divide that into 3 approximate zones of just over 8 centimeters. Okay. The next thing you want to do is identify the ideal zone, which is the upper middle third of the arm. So 1/2 of this distance. As you see here, the ideal insertion area is the proximal half of the middle third of the arm. Or on this person, it would be between 13.5 and 17 centimeters. This is the area where the basilic vein should be the largest. It should be the most stable location, and it'll avoid areas of flexion. As you can see here, in the lower zone, the compression that happens with the elbow flexion. So you want to avoid this area. Additionally, in this area, which I call the red zone, the median cubital and the basilic veins come together to form a larger basilic vein. Besides the flexion, your dressings will have trouble with adherence, and you'll probably see more signs of vein trauma with procedures in this area, and more difficulty advancing wires. Extending into the middle third of the upper arm, or green zone, the basilic vein will generally increase in size and depth. It will also correspond with a transition as it dives under the brachial fascia and becomes more stable for puncture. This occurs in the middle of the upper arm. Extending into the most proximal zone, you have the axillary a colonization that we're concerned about. You have more moisture and hair in this area, so you want to be cautious in the yellow zone and not to extend too far into it. The patient's ideally positioned with the arm abducted. The head of the bed is near flat. Anywhere from 0 to 15 degrees is recommended. The next trick I use is taking a rolled hospital towel to stabilize the underarm tissue. You just do about a half a roll, and we just want to go under the bottom half of the tissue here. You don't want to go under the humerus. And what this does is create a stabilized platform for the arm, but it also creates a flat plane to scan with the ultrasound probe, so we get ideal images. So the ZIM insertion method ultrasound assessment starts with finding the brachial artery and the brachial complex, which includes the median nerve and brachial veins. So here, directly above the humerus, we see the brachial artery. To the right of it, or more medial, we see the median nerve. And then, on either side of the artery, you see brachial veins. Moving medially, you'll find the large basilic vein as After tracking the basilic vein to the red zone, we find the communication of the median cubital and basilic veins. This is a key feature in the red zone. We want to get beyond this point. So after that communication, the basilic vein typically is a little larger. Moving proximally, the basilic vein should increase in size and also go deeper. Moving into the green zone, it'll be fairly stable. There's a key transition in the green zone of the basilic vein where it dives under the brachial fascia. It becomes a deeper, more stable structure. Typically, this corresponds with the transition into what I call the ideal part of the green zone, or the upper part of the middle third of the arm. Now within the ideal zone, you want to find the actual insertion location that you're comfortable with. This will be a combination of vein size, depth, and clinician preference. Extending beyond this area, you'll be in the yellow zone. The vein will get deeper and may increase in size, but then you have to contend with the axillary hair and moisture and potentially more colonization of bacteria. So after doing a complete upper arm assessment, we find our location and then we'll mark it for insertion. I do this by establishing a lateral mark first, and then you use your towel to remove a little gel. And now I give a center mark on the arm. So you've established a crosshair pattern so you can measure for your length of pick insertion. And you can see here that we're in the middle zone, which is between 8.5 and 17 centimeters, and the ideal insertion location is at 16 centimeters from the medial epicondyle, nearly at the end of the green zone.